Normally, the patient will come to us because of the pain at the knee. Second one is the swelling and maybe warm sensation because of the inflammation that happen of the arthritis. The third one is the limping. Most of the patients that have the knee arthritis cannot walk well because of the pain and stiffness, so they will walk with limping. And in the advanced arthritis patient, the patient will come to us because of the deformity of the leg. Some patients have a knock knee, some patients have the walrus knee or the crook knee. So this is all the signs of the patient that have the knee arthritis. In the patient that needs the knee replacement, we can use a VELYS technology to help for the smaller incision, and it can provide the patient less pain and better movement and faster recovery. And there's no need to use CT scan as the previous generation of robotic system. And lastly, it can increase the longevity of the implant and better patient satisfaction. We have several cases that have a successful outcome of the VELYS robotic system. One of the cases that have a very bad deformity, some cases have a severe crook knee and also knock knee. So we can correct this deformity by the VELYS robotic system. We can do the surgery to knees at the same time, and at the end, these cases can have a good alignment of the knee after the surgery. In some cases that have a high BMI or the overweight, we also can use the VELYS robotic system to help to address this thing. And most of the patients with a high BMI can walk within 6 hours after the surgery. So at the end, the VELYS technology can help to address the pain, faster recovery, and the better longevity of the implant.